Assalamu alaikum. Assalamu alaikum. I'm Professor Mohammed Moin. I'm working as Professor of Ophthalmology at King Edward Medical University. And I was at Amiruddin Medical College for 10 years. And the pleasure of teaching Dr. Abdul Rafi, who's now in UK after having worked in Ireland for a few months. And we need to ask him, how do you choose your specialty while you're going abroad? What steps can you take while you're doing your training, while you're doing your MBBS in Pakistan? And what is basic surgical or medical training, and what is higher surgical or medical training in UK and Ireland? Because both of them are separate. Yes, Dr. Rafi.
So thank you very much. First of all, for having me, and I was really lucky to be your student at Amiruddin Medical College, because teachers like you really helped me and guided me a lot. And I'm honored to be on your podcast today because you gave me the time to share my thoughts with the medical students and my colleagues. Going forward and letting that how to choose a specialty and how to plan your training application, because I was lucky and Alhamdulillah, I must say that Allah blessed me that I got into training program now, both in Republic of Ireland and UK recently, got matched in training separately. And I have a privilege to either choose to go back to Ireland to start my basic medical training, specialty training in general internal medicine in Ireland, or just move from August to a different area in UK, in England, to start my internal medicine training known as IMT here. So, regarding choosing a particular specialty, it is always something that keeps on coming on every individual. Even at this particular moment, when I have already chosen a particular medical side that I want to train further, I'm sometimes still get confused that whether I should be opting for a GP training or for a surgical training. These questions keep on coming to every individual, I guess, throughout, unless they're finally dedicated towards a particular specialty or if they're training in that specialty. So it was kind of a dilemma for me to choose between a surgical specialty or a medical specialty, because I was working in orthopedics. I was not enjoying the time that I wanted to enjoy there, because I feel that I am more kind of a person who requires to work in all hands open rather than being very focused in a theater, which requires a lot of precision, because I feel that I'm not a precise guy like an ophthalmologist who can, knows the nitty gritties of treating the delicacies of eye or something like, dealing with the bones. I feel like I will get overwhelmed in that. So that was one of my motivation to opt for a specialty that is more aligned towards medical side in medicine, I must say. So I went to the orthopedics to have a flavor of the surgical rota as well. Then I found out that my true calling is probably towards the medical specialties, which I will decide that with what particular higher specialty I want to go after, do after my basic medical specialty training. In Ireland and UK, and they have separate applications, if I must say. This is known as a basic specialty training in general internal medicine, or core specialty training in surgery in Ireland. And in UK, they call it as an IMT, internal medicine training in UK, and then they call it core specialty training in surgical specialties. And in all of the specialities, like in Ireland, UK, they have GP practice, they have ophthalmology training, they have psychiatry training, and there are all other specialities that you want to train in. In UK, they call it as a run-through program for certain specialities. For example, I guess it's for ophthalmology, it's a run-through program, and then for emergency medicine, they also have a run-through program that you particularly train straight for 5 or 6 years in a particular specialty, and then you become eventually a consultant. But for basic, for young candidates who are new to the system and who want to get the best flavor after their foundation years, which is equivalent to FY1 as a house job and FY2 as a medical officer job, it is highly recommended that they go through the training process in both UK or Ireland. So starting off that how to plan your applications, it's very necessary for a medical graduate who is for a medical student who is currently studying in a medical college always be engaged with both the co-curricular and the curricular activities, because it will help you with all the points that you require to score higher in your applications to eventually get an interview for the training, either for the medical specialty or for the surgical specialty. Because for me, I was working with the debating society, I had the privilege of that, and then I worked as a president, and they specifically score you for being a president or a general secretary, or at some post if you're working in a particular specialty as a leadership marks. They give you 2 marks for that. But if you were working as a higher someone, if you're working at a national or regional level, let's say in UK they have an association known as BMA. In Pakistan they have an association known as YDA, which is not that famous for many things. But if you are a member of that, and if you have a certification from these people as well, and they provide you with a strong foundation, because what BMA is doing here, YD is doing in Pakistan. So if you're a member of those organizations and you are you are an office bearer of that, you can claim leadership marks for that. So it's very vital. And then come the second portion is that a lot of people say that there is no benefit of having distinctions in Pakistan now because they don't score you for getting distinctions. But here in UK and both in Ireland, they give you extra 3 marks if you have attained 85% in university exams. So this was a plus point for me, that I luckily got 2 or 3 distinctions. So this was also helped me with that. And then the third thing is with publications. If you have a PubMed indexed publications, whether be it an original article, be it a case report, or it can just be a editorial writing, or if you have been a part of a chapter in a book being published in a particular specialty or in journal, they give you marks according to that. If you are a first author of a PubMed index journal, then you get 8 marks out of that. If you are a second author, or if you are a co-author, or if you are first author of case report, you get 6, 5 marks, and so on. So this is about publications. Then there are 5 marks for scoring for conducting 2 cycles of a quality improvement project. I did one in Pakistan, and I completed both cycles while in Ireland as well as a lead author. So I got 5 points for that as well. So this is how you plan things. And then there is scoring for teaching as well. If you have been particularly teaching at a medical institute as a demonstrator after your house job, or during your house job, if you're teaching your medical students and colleagues, either in the form of presentations or in the form of teaching them basic the clinical exams, or if you are helping with OSCE organization of your final year assessment exams, you get the feedback. This is really important. Make an online form. There is available on the websites as well, but you can devise your own with the help of your dean of your medical college to make a form for that, and just get a feedback from your students and the colleagues, and make sure you upload it as a documentation, and finally get a certification of that. If you help organize, devise kind of a curriculum for the learning outcomes for the house officers, or let's say for the medical students during their particular rotation, you can claim full 6 marks for that. If your deanery approves, if your dean of medical college approves that, or if your head of department approves that, that's that simple. If you just participated and organized a teaching session, you can still claim 3 marks, but it must be more than 3 months. This is the minimum requirement for that. So I was lucky that I got with 6, because I was approved by you and with the head of departments from all 4 of my head of departments. So afterwards, there is also a course known as Train the Trainers course, which I did while from RCSI Ireland, because I was lucky that is one of the recognized courses on teaching. Because of my strong interest for teaching, I did that course, although I didn't put it on my self-assessment sheet that I am claiming marks, because I did after the application. But this is really helpful. The people can do PG Cert diploma. This is equivalent to 8 or 9 months of diploma in teaching, and that gives you 3 marks. So they have their different categories that you need to score in your application, in your self-assessment score sheet for UK. Similarly, these will help you for Ireland as well. If you have worked, because UK gives you a proper guidelines that how you can self-assess yourself, and this eventually helps you. And afterwards, if you have any postgraduate degree, which I don't have at the moment, which was like they don't include any MDMS or FCPS Part 1 or MRCP or MRCS as a postgraduate degree, even if you have completed those. They are just the specialty exams. This will not give you any other marks. The people have confusion. They think that if we are done with MRCP or MRCS, we are scoring higher. There is 0 marks for that. So they eventually help you make sure that you are quite dedicated or towards a particular specialty and you have the right knowledge, this will help you long way, but it's not a requirement for the application system at the moment. And then they have the other some certain commitment to specialty things that you can look at through website, which I can share the link for UK one. You can pin on your podcast, because this will help them understand the score sheet, and that's quite similar for almost all the specialties, because they have made a criteria even for HST, for the higher specialty training. They have the similar criteria, but you have to show more proof or kind of evidence for higher specialty training, because you are dedicated towards a particular specialty. For basic training, if you have done one thing for a one specialty, you can apply it across both specialties. And this is how you plan your application. And for Ireland, there is another thing that you require. This is a MSPE form, if you remember, that you used to make for the students doing USMLE examination, because they need to submit it. In Ireland, if you have this, and if that form shows you that you were among the top 10 or 20 candidates of your class, because people say that if you score high in your medical school, you are not getting any reward. This assumption was wrong until I moved to Ireland and until I submitted my application. I was lucky that I got highly scored in my application in Ireland. That's why I was able to get an interview in Ireland, because getting into the training in Ireland is quite competitive at the moment as compared to UK one, because UK give you complete guidelines that how you can process your application. In Ireland, they open an application on RCPI website for medicine and RCSI website for surgery. You fill online application, you self-assess yourself and submit with the evidence. In UK at the moment, certain specialties require evidence, but it's always recommended never cheat. Submit, have your evidence ready for everything you do. You can submit evidences from Pakistan. So making it simple, in Ireland, you require an MSPE form showing that you have scored well enough in your medical school and you were among the top 10 graduates. And then you submitted the application. Because in Ireland, some people say that when I moved there, that you can never get into the specialty training at all in medicine or in any other specialty. And I was working in orthopedics, and they say that you don't stand a chance in UK or Ireland to get into medicine because you're working in a surgical specialty. But I had my application well crafted for this particular specialty. So I submitted the application and I just prayed, and eventually I got interviews from both Ireland and UK separately. So going forward again, what I did in terms of specialty training was that to make sure that my application stands out, and I did everything right. And it helped me a lot in the longer run with the help of all the guidance from you and all of the seniors. Specifically, after my house job, I was doing a private job. One of the doctors, Dr. Tariq, helped me with it with a QIP. So this is how you keep on making good connections, keep on asking your seniors and your mentors and teachers. They will help you with that. So make application strong. And then I applied for H. But for UK, if you want to go into surgical specialty training, or let's say the GP or psychiatry, they have an exam known as MSRA exam. That is one of the requirements that you need to score really high for that. For example, out of 700 or 650, you need to score more than 500. And for surgical specialty, for GP and for psychiatry and GP and psychiatry are two specialties which only require MSRA exams ranking. If you have scored well, you get into GP scheme straight away in UK. If you have scored well, you get into psychiatry training straight away. You don't need anything else. But for surgical specialties like ophthalmology, you need to score really, really well in MSRA. And then you need to score really high in interviews, because they are very competitive fields. But people do get this, and people have got this training according to their curriculum. So this is how you need to plan the applications. And finally, there is an interview process that is really, which I say, highly competitive for both UK and Ireland. In Ireland, there's like 10-15 minutes, but for UK, they do a complete 30-minute working on 3 domains. First is giving a presentation about your achievements regarding to a particular specialty, what you have done so far. Then there's another question about your suitability for IMT, or for surgical training. You have to convince them that I was working in orthopedics, why I am now coming to medicine, what's my rationale behind that? So my answer was clear, that I intentionally rotated through because I wanted a flavor before making an informed decision. And I planned my application accordingly, according to medicine. This shows my dedication. So they were quite good, and they gave me really high marks for that. And then there is other question is about a particular research if you have done. They will ask you to explain how have you done that, because this will let, if you have cheated them by having a fake or a forged kind of a certification or publication, they will know in an instance, because they know that if you know your thing, you can explain it well. If you don't know your thing, you will be in problem. And they don't take a second. I have seen people getting struck from GMC or IMC because of not being able to provide uh, evidence for their reasoning, even for forged publications. So finally, they ask you a question about a clinical scenario. They show it on the screen, and then they ask you to how to approach it. Then they ask you to manage it, and then they ask you what's your differentials. It's like a complete Viva interview happening at your final year medical exam. And then finally, they ask you an ethical scenario. They give you a scenario if your consultant is being drunk, or your consultant is harassing someone and you have seen it, and if your senior is doing something. They put you in an ethical scenario situation where you feel troubled. That in Pakistan we find, we see if something is happening wrong, would never put up a question in a right manner. Even if we do, we don't know how to tackle this. So there's a proper preparation for interview as well, that you need to take the questions on board. And afterwards you get the final ranking released, and if your ranking is good enough, you will get a training job in UK. But in Ireland, if you are young like me, and if you don't have a stamp 4, sorry, people used to say that you're not getting training. But I have seen me and a lot of other people who were in Ireland who were on stamp 1, which is like in the first 2 years you don't get stamp 4. After 2 years you don't require a work permit to work in Ireland, which is somehow not equivalent to an ILR in UK, but somehow considered equivalent, because you don't require any other visas for the job, because you have this IRP and you don't require any other problems. So if you have stamp 1 but you have scored really well in your application, you get interview, and everything then depends on your interview. But in Ireland, your application and interviews cumulative scores help you get a seat, although the merit for stamp 1 holder is quite high. For example, who were the Irish nationals and the EU candidates and the stamp 4 holders, their merit was to score 55 or above to get into the specialty training in Ireland in medicine. But for candidates like me, their cutoff till now is 73 or 72 out of 100. So there's a vast difference. But I scored 80. So I was lucky that I scored 80 because my application was so good. Even though my interview was not that good, to be honest. I messed up a question. So I combined score. In UK, the only benefit of having all these things is to get into the interview scheme. After interview, everything is subjective on your interview, how well you perform in all these 5 questions. If you have done well, although this year the competition for IMT has tripled as compared to last year, because there was self-assessment score last year was around 8 if you need an interview. This year it's 15. So it shows that how you score. And I scored 22, but one of my case report and one of my teach the trainer scores, which I didn't put in application, was approved afterwards. But I did mention during my interview that scored me 9 out of 10 for my suitability and my achievement portion. This helped me a lot. I messed up again in one of the portions because I was not quite clear about a terminology in medical field, which they downgraded me, and that put my rank a bit lower than I was expecting. But luckily that was good enough for me to get into the training in UK, because if I got training in Northern Ireland, then I upgraded to Wales, and then finally to England, because my priority is to get trained in England, because this is what you have taught me. Always look up, don't go beyond, don't go backwards. So that's what I was aiming for, and now I'm lucky that finally my final upgrade is on 9th of April, and I see where I land up in England, inshallah.
So thank you very much, Rafe. I think it's a very enlightening talk. Did you tell us all the details? I think the most important thing is to plan yourself in advance. I think all the numbers count, and getting into that interview, because there are hundreds of people giving the same thing, to getting those numbers in each and every slot gives you the opportunity to get there. And obviously to be there at the right place at the right time always gives you an opportunity. Don't feel any threat is something which is going to bar you from getting into that thing. always try to make a threat into an opportunity, always try to look for opportunities, always search for them, and then be determined to do them. Do your research on wherever you're going. Even when I was giving interviews, I would just go in on the internet, look at the consultants whom I'm going to give the interview, look at their CV, what they do, what their interests. And so you should be able to talk to them, converse with them about those things so they can show interest in you as well. So thank you, Rafi. It's a really a wonderful talk with you, and we'd love to hear many more things, especially how to get visas and which are different types of visas. I think your journey is going to be a long journey, which is going to transform your education and learning. And we look forward to seeing you back in Pakistan to serve Pakistan as well. So thank you very
It is
much.
also my
Khudafis.
inshallah. Thank you very much for that.